AP 120, Lab 12, Topics Respiratory System. So, we're talking about the respiratory system with the upper respiratory tract, including the nose, nasal cavity, and pharynx, and the lower respiratory tract, including the larynx, the trachea, the bronchi, and of course, the lungs. So, functions of the nose includes warming, cleansing, humidifying the inhaled air. So, as the air enters the lungs, it makes contact with the mucous membrane, which helps to warm it. Particulates get caught in the mucus to help clean it, and water will be evaporated into the air, humidifying it. Also, we're able to detect odors in the nasal cavity. The roof of the nasal cavity houses the olfactory epithelium, which can help us detect scents by the chemicals that bind to its receptors. And then finally, the sinuses and the nasal cavity are able to act as resonance chambers that help to amplify the voice. The nasal cavity is aligned with three structures that protrude out on the lateral walls. So there's right and left nasal conchae, and they fold out and they're covered with the mucous membrane, and they cause the air breathed in to swirl to help expose it more to the mucous membrane to get the filtering, the humidifying, and the warming of the air. We also have the sinuses, the paranasal sinuses found in bones of the skull. Paranasal sinuses are lined with mucous membrane, and they are connected to the nasal cavity. Includes the frontal sinuses, the sphenoidal sinuses, the ethmoidal sinuses, and the maxillary sinuses. Leaving the nasal cavity, from breathing in, you lead to the pharynx. Pharynx, or back of the throat, has three regions. The nasopharynx would be the first region met. That also contains the opening to the auditory tubes, which lead to the middle ear, as well as the pharyngeal tonsil, there to deal with any pathogens that try to cross the mucous membrane into the body. Makes a 90-degree turn downward, leading to the oropharynx. The oropharynx comes directly after the oral cavity, and it includes the palatine tonsils. And then inferior to that is the laryngopharynx. The laryngopharynx is superior to the larynx and the esophagus. Here is a model of the larynx. Here's the hyoid bone, the thyroid cartilage that sticks out anteriorly, and the cricoid cartilage. So all of this is larynx. You also have the epiglottis. Epiglottis is the most superior cartilage, and it is important for swallowing because when we swallow, the epiglottis will fold over and cover the opening to the larynx, thereby preventing food and drink from entering the respiratory system, which is a good thing. We don't want that to go down the trachea and cause us to cough. The thyroid cartilage is the largest of the cartilages, and the cricoid cartilage is the last portion of the larynx, and it attaches to the trachea. So all of this down here is trachea. Here again is the epiglottis. Again, it covers the opening or glottis to the larynx and will fold over to cover that space. When we look inside of the larynx, we see there are two folds, a superior false vocal cord, and there's a pair of them, and the inferior true vocal cord, and there's a pair of those. And the false vocal cord can close or open the glottis, the space in the larynx, and the true vocal cord can vibrate as air hits it, producing sound. And there are many muscles found within the larynx, intrinsic muscles that can tighten or loosen the true vocal cords, allowing for a higher or lower pitch in sound. And there are also extrinsic muscles that help to elevate and lower the larynx for swallowing purposes. All right, inferior to the larynx is the trachea. The trachea then travels down into the thoracic cavity. Trachea has 20 cartilaginous rings that keep it open at all times, so there's always air in the trachea. There's also always air in the larynx. The trachea at its inferior end will split into the right and left main bronchi. They are similar in structure to the trachea, and they are the first structures to enter the lungs themselves. They cross an area called the hilum. Hilum is just the portion of the lung where structures are going into and out of the lung, so the main bronchi, the blood vessels, nerves, and so on. The right lung has three lobes: the superior lobe, the middle lobe, and the inferior lobe. The left lung has two lobes: the superior lobe and the inferior lobe. The left lung also has this little notch here called the cardiac notch. That's making room for the left side of the heart because the left side of the heart is bigger than the right side of the heart. And then, of course, below the lungs, inferior to the lungs, is the diaphragm, that sheet-like muscle, which is critical for breathing in. The bronchi, the main bronchi, enter the lungs. They then split into the lobar bronchi. 3 lobar bronchi for the right lung, 2 lobar bronchi for the left lung. They then further split into the segmental bronchi, going to different regions of the lungs. And those then further split into smaller and smaller bronchi to get to the microscopic bronchioles. So, trachea splits into the main bronchi, then the lobar bronchi, then the segmental bronchi, then smaller and smaller until the microscopic bronchioles, which lead to, of course, to the terminal bronchioles, which lead to the alveolar respiratory bronchioles, which then lead to the alveolar ducts, which lead to the alveolar sacs, which lead to the alveoli. When we get to the bronchioles, you can see that they are microscopic structures carrying air deep into the lungs. They have no cartilage associated with them, only smooth muscle tissue in their walls, so it's the smooth muscle tissue that keeps them open. They end in the alveolar sacs, and of course here is the walls of the alveoli, super thin, simple squamous cells that then are adjacent to blood capillaries to allow for gas exchange, oxygen into the bloodstream and carbon dioxide out of the bloodstream. So again, when you get to the alveolar sacs, all the alveoli, the grapes as it were, surrounded by pulmonary capillaries to allow for that gas exchange to occur. And that gas exchange occurs at what's known as the respiratory membrane. Respiratory membrane being the wall of the alveolus adjacent to the wall of the blood capillary. 2 simple squamous cells, so extremely, extremely thin. And this allows oxygen to diffuse from the air into the bloodstream and carbon dioxide to diffuse from the bloodstream into the air, following the pressure gradient. High pressure to low for oxygen, high pressure to low for carbon dioxide. That is it for this part of the lab lectures.